Assalamualaikum and welcome. My name is Rusmawati Abdul Rahman and I am the director of the Siri Pulang ke Gagang program or SPKG. We are here today as part of the ESPKG Virtual Symposium and thank you for being here. With me today is our special guest, Dr. Noraza Abdul Rahman, a consultant ophthalmologist specializing in pediatric ophthalmology and strabismus surgery. She is currently with Ara Damansara Sime Darby Medical Center. Dr. Noraza has served more than 20 years as a medical doctor. She served the Ministry of Health and worked in various government hospitals throughout the country. Currently, she is working under Ramsay Sime Darby Medical Center. Dr. Noraza is actively involved in training resident ophthalmologists, general practitioners, paramedics, and more. She is an experienced speaker and has been a guest on media including MyDoc, NTV7, Malaysia Hari Ini, BFM radio stations and the like, with the goal in educating the public on eye health and prevention of blindness. Welcome, Dr. Noraza.
Thank you.
My first question today is, are you a pediatrician, an ophthalmologist, or both?
Thank you, Rosmawati. I am trained in ophthalmology field, so I am an ophthalmologist first. Generally, in ophthalmology, we treat various eye-related disease and we perform surgery to treat many eye blinding conditions. If you're familiar with the vision-related disease, eye-treated disease like cataract, which is cloudiness of the lens, glaucoma, which is blindness arising to the nerve damage, and diabetic retina problems, and many more. Basically, ophthalmology is a mix of medical and surgical field. Yet, it is not precise enough. I had to pursue further knowledge in children's eye-related disease. This field is called pediatric ophthalmology. It is a subset of ophthalmology. In this field, I treat children's eye condition, including pediatric cataract, glaucoma, lazy eye, progressive short-sightedness, and also squint, which mean eye misalignment. It is a unique field because we involve in children's eye care, noting that children's eye are unique. Various visual-related problems in children, if left untreated, will affect their future and guide the children who have vision problem to unleash their full potential.
So meaning to say, in each specialty field there are subspecialties with more focus on certain fields. And how many subspecialties are there in the medical fields?
Well, there are too many. Medicine is a wide field. In medicine, there are many specialties, whether you want to be a physician or a surgeon. And there are many subspecialties in each specialty. For example, to become an ophthalmologist, you have to enter medical school, graduate as medical doctors, and then pursue further in the field of ophthalmology. This is a specialty. A subspecialty is a specialty under another specialty. For example, for eye, can you imagine? Eye is small organ, but we have 9 other subspecialty in ophthalmology like refractive surgery, glaucoma, cornea, retina, and others. The importance of doing subspecialty is when we are dealing with specific disease and we want to be precise in delivering complete or advanced treatment to optimizing the outcome.
Alright then, so let's now bring our leaders to the start of your journey to becoming a medical professional. So where did you receive your medical training?
Well, the journey of a doctor takes many paths. My own journey may be different from other doctors, so I will share my own experience. In 1990, we heard about Bosnian War, ethnic cleansing campaign in Europe. I saw a footage on national TV about a small town under attack, and there was this old man who was injured on the street, waving hand to the camera, begging for help, and no one responded at that time because nobody knew what to do. At that point, it inspired me to become somebody who knows what to do and to help others in need. Well, I worked hard for my SPM, but I did not get straight A's. After SPM, I enrolled in Asasi Science in University of Malaya. Here, I faced tough competition because only the top students could enter medical school. I remember I studied hard, routine library trips, and a lot of walking during the course. Well, after 2 years, I was accepted in University Malaya Medical Faculty and started my journey as an undergraduate. During the preclinical years, we attended classes, lectures, and lab. Well, I remember during my first year, I studied anatomy, physiology, biochemistry, and we had to go to dissection hall to dissect a preserved human body. We studied everything involved normal human function. In our second year, I studied disease-related subjects such as pathology, microbiology, and more. Getting through studies was tough, long hours, and we had to memorize many subjects. The passing mark was 50%, and if you fail, you are kicked out of the program. But we persevered. When I say we, I mean I'm referring to a group of friends that studied and worked together. It was hard due to the competition, but we never compete each other. We competed within ourselves to be better, to know more, and to gain knowledge. We learned about memorizing techniques, and we never felt embarrassed to admit our weakness. Then I entered clinical years where we have to do rotation in various specialties like medicine, surgery, pediatrics, or children's ward. Here is when we get to bring our stethoscope and our lab coat to the ward. We talk to patients about their medical history, learn about how to examine a patient, practice our bedside manners, and learning how to pick up signs of diseases. Clinical exams were tough because we were given a short time to get full history and to diagnose a disease. During the exam, you will be watched and evaluated if you perform all the examination steps completely or incorrectly. Alhamdulillah, I passed my medical degree in the year 2000. Well, I thought my life was fine after, but it is only the beginning of my journey.
You mentioned surgeon and medical doctor somewhat interchangeably. Is there a difference between the term medical and surgeon?
Well, medical-based fields are like medicine, pediatrics. You become their physician and perform some procedures. Surgical-based are like surgery, orthopedics, which is bone, eye, ear, nose, and throat, when you deal with patient and gets to perform surgery on them. In surgical field, we often have to be ready in case of emergency surgery. Regardless of the time of the day, usually in emergency situation, the anesthetist will triage the cases. Those involved in life-threatening situation will be done first. Often for eye cases, we can only get to do a bit later of the day or maybe even at night.
For those graduated medical school in Malaysia, must they work under Ministry of Health? What kind of work or training is available to them upon graduation?
Alright, back then when I worked with the government, the system is a bit different compared to what we have now. The working environment during my time was a permanent post, but now the new doctors are given contract posts which need to be renewed every 2 years. And then hopefully they can absorb into permanent posts starting 2022. Both can receive or pursue a postgraduate program, usually after 4 years of services. And as a houseman, you have to work the normal work and do on call, meaning that you have to work for 24 hours in the first year of posting. But the current program is you do a 12-hour shift and there is no on-call. For housemen, the program will take about 1 year, but now it takes about 2 years and you have to go to all the compulsory posting. My own experience from medical officer to specialist is an example of career progress that come from the support of the Ministry of Health. In 2009, I graduated as Masters in Ophthalmology from University of Malaya, and the following years, I was transferred as a Gazette Specialist in Hospital Tengku Ampuan Ahzan Kuantan and fully Gazette as an Ophthalmology 6 months later. Well, I remember being happy to finally pass my master program. In 2011, I was posted back to Kuala Lumpur Hospital to join as fellow in pediatric and strabismus in Kuala Lumpur Hospital. It was here that I received more exposure in dealing with children and their eyes-related diseases, and marked another career milestone. 3 years later, I completed fellowship program and become consultant ophthalmology and certified pediatric ophthalmology and strabismus surgeon.
Okay, well, Dr. Norazah, there was such a journey that you have experienced and shared with our fellow student here. One question that I always wanted to ask real doctors, which is, are trainings in medical dramas on TV are accurate?
Well, most of the local drama are done without getting medical inputs. So we often laugh at how the set was being made and how the instruments were used wrongly. In reality, medical drama did not capture the full reality of being in medical field. For example, about housemanship. Being a houseman was not the same experience as medical student. During medical school, we work closely with other students, and our lecturers are always there. As housemen, we mostly work alone to take care of our patient. We were always busy, deprived of sleep and proper mealtime. We had to take blood, trace the result, and perform ward round for hours while answerable to the senior medical officer or specialist. We often reprimanded if we are slow or show lack of clinical knowledge. Back then, bosses were tough. Here we learn about responsibilities, but life is mainly about work. No families, no family trip. We usually had 1 day off in a week where I spent most of it sleeping. We just need to recover for the next day. If we are on call, we do an on-call where we work 24 hours. If we are lucky, we get to get some sleep and continue to work to the next day. I remember I was paid about 25 ringgit as my on-call claim per day. But at the end of the posting, you will be evaluated on your competency, attitude, knowledge, punctuality. If you don't perform well, you get to be extended. At that point, we are doing our best to go to another posting.
But for now, medical graduate who does not want to work with KKM or Kementerian Kesihatan Malaysia, where can they practice? And what do they need to ensure that they have the same standard of professionalism?
For medical graduate who wants to work outside of KKM, they must complete their housemanship and get their practicing certificate, which they have to renew it yearly. Then they could work as part-time doctors, open up your own general clinic, or even work in the private hospital. But as a medical doctors and working with the KKM, Kementerian Kesihatan Malaysia, there are several paths to follow and grow your career. As an example, I completed my housemanship in 2001 and gained my practicing certificate to become a qualified medical officer. Some of my friends were transferred to district hospital or work in the clinic kesihatan. I was transferred to Klang Hospital in 2002 to pediatric department and surgical department. Here I learned about responsibility. I give order to housemen and do the call or ward round and work with the specialists. The specialists were very busy and stressed. Your job is to make their life easier. If you fail, you can be yelled at. Well, it's okay to be yelled when you are a houseman because you are learning. But if you are already in a higher hierarchy, it is so embarrassing, especially in front of your junior resident. My definitions of good call is when we could get some sleep, a good sleep after 2 a.m. And my job during on-call is to keep all patients alive at least until the next morning. Besides that, I still do a part-time job. Well, after a few years, I have one boy and my salary was small. Basic salaries I remember is around 1,800 and I had to do a part-time job after work. So I went home to shower, buy dinners and continue to work in the private GP clinic until 10:30 at night. And I remember I was paid around 30 ringgit per hour. Well, in 2004, I was absorbed in the master program in ophthalmology and later was sent to eye department Kuala Lumpur Hospital as a resident. And 2 years later, I joined University of Malaya Medical Center as a resident in ophthalmology to complete my training rotation. So it was 4 years program where I was trained to become an ophthalmologist. We had to run services, manage the clinic, perform surgery, at the same time doing on-call and emergency surgery in case of severe eye injury. As ophthalmologists, the work are mostly clinic, with heavy numbers of patients. Have you been to an eye clinic? If you have, you will know about the patient's load and the waiting time. It is a long waiting for patient and even long working hours for the doctors, sometimes without lunch break.
So I'm backtracking a little bit. So if you are working for the Ministry of Health or KKM, meaning doctors in public hospital are government civil servants. So there is a well-known fact that government doctors face very heavy workloads and responsibilities. Is this true? And are civil servants compensated fairly in your opinion?
Workload may not be as much as I was a junior doctor, and I have many service medical officers, resident, gazette specialists, and specialists under me. Unknowingly, the responsibility is overwhelming. Not only I have to deal with complicated disease that was referred to me, we also have to manage with patient and parents' emotional and socio-economic issues in order to deliver best treatment to the child. Well, treatment has to be up to date, and we must equip yourself with all the knowledge and surgical skill of what is the best and the latest treatment. Well, as you know, Kuala Lumpur Hospital is a premier referral center, so we got cases which cannot be managed by other hospitals in Malaysia. There are times when we are stuck, then we have to refer to a consultant from overseas on the management sometimes. Not only that, we have to give training to the paramedic, doctors from resident, supporting service, gazette specialists, and fellows. We are involved in the management of human resource in the department. And in government service, being transferred elsewhere is a common practice after ones get promoted. We often get new staff with little clinical knowledge that we have to train. With regard to the starting salary as a houseman back in the year 2000, I earned around 1,800 a month as my basic salary. Yes, you can have some benefit and bonuses, but not much else. Of course, there are salary increment each year or each level, up to the last salary at senior consultant level. The benefit that you get for both parent, spouse, and medical children medically covered under KKM.
So in medicine, doctors face the risk of cases that may lead to potentially serious outcomes. So on that note, medical malpractice is also part of what doctors have to manage in their professional lives. So how are medical malpractices cases reviewed and handled?
Medical negligence happens. Most of the time we have standard operating procedure, and most of the time the patient is being managed by not a single doctor but a team of medical profession of various hierarchy and specialty. That's why we rarely overlook any complication. And in surgical field, before surgery, patients are made aware of the complication and they had to sign a consent. If you follow the protocol, most likely you have done nothing wrong. Well, mistake happens. Mistake happen when you are too busy, not working in a team, and not focused. Well, you know your limit. If you can't handle this case, ask for help. Well, when we talk about medical negligence, doctors should have an insurance against malpractice. As a government officer, you still have to buy your policy for medical indemnity, but the rate is not as high as those working at private hospital. Well, for private hospital doctors, you have to buy your own medical indemnity coverage, and the premium depends on your specialty. If you're involved in a high-risk procedure, the premium is higher. Well, it can range from 5,000 to even 70,000 per year.
Now, let's talk about COVID-19. The COVID-19 pandemic has demonstrated that medical professionals, especially those working in public hospitals, are our frontliners. The first to treat those infected, but also those who are more susceptible to COVID-19 infection. Any thoughts and reflections on this subject?
During my practicing year, I have seen many situations, starting when I was a medical student. Back in 1998, when the outbreak of Nipah virus and the Hendra virus. Well, I was doing emergency posting when I saw people with massive brain infection. Then comes SARS and H1N1 endemic and epidemic. Well, we are aware and taken all the necessary precautions, but this does not reach us. Well, we heard some frontliner contracted these diseases or even died. But COVID-19 pandemic is by far the hardest hit because of the close human-to-human transmission. When COVID-19 came knocking on our door, it will hit everybody. It is massive, and even now we are still struggling to get back to normal life. During this pandemic, medical fraternity have lost many lives throughout the world. Well, in ophthalmology itself, we have lost more than 30 doctors, including Dr. Li Wenliang from Wuhan. And as a frontliner, we always put the public and service need first than ourselves. Work is work, and responsibility need to be addressed. The true reality is that among frontliners, we have many life lost due to infection, stress, burnout affecting our health. I have lost 2 close friends. Here I hope to increase awareness to public about our cry. We are human beings too. Sometimes we get sick. Sometimes we make wrong judgment. We are just trying to help, but sometimes was being used and abused physically and emotionally by others. So be kind to your frontliners and please maintain your SOP.
It is clear now that being a doctor is not as easy as one might think. The learning process is never ending, and it seems like there's more sacrifice have to be made than the rewards reap. Why would anyone want to be a doctor then?
Well, my advice, if you're really interested, then pursue your dream. This field is tough and not for the weak mind. Work is hard, long hours, and doctors always put their patient and professional first. But it is all about your personal satisfaction. After a hard day at work, sometimes I don't even get a thank you. Or some of my patients don't even recognize me as their surgeon. But I know I have done the right thing and be happy about it. Don't get me wrong, some patients are very grateful. They reward you with nice gift, food, or even card. If you want to be a doctor, you must have a strong mind. Hard to pass. To become a doctor, busy work. You don't get enough rest. You must have patience. Well, you can plan your day, but sometimes it doesn't turn out to be how you plan it. You can scold it for any mistake made regardless of your level of hierarchy. Be empathy. Always treat your patients like you treat yourself or your family members. Remember, a doctor is not a good doctor until she or he become the patient themselves. Respect others, regardless of their level of education, social economic status. You don't know what they went through their life, and persevere. At any level, junior or senior, there is always be more problems, always be more struggle. And you must learn how to solve this. This is about life. In medicine, the winding road lead to infinity. There is never end of it. You have to continue to learn, to survive, and remember what doesn't kill you will make you stronger. Only death will stop you from the struggle. Always look back and analyze. Are you better than before? If yes, be grateful. Make others better. The Messenger of Allah, peace and blessing be upon him, said that the best people are those who most beneficial to others.
So I have a question that's a little bit different from the rest of the questions. So what is a Hippocratic oath?
Hippocratic oath is a principle that every doctor should have. That we do not cause harm, we must be safe healer, we do not use our position for personal gain.
So that's very interesting to know, Dr. Noraza. So I think we have covered a lot of things today, and I would like to really thank our guest, Dr. Noraza, once again for her time. I certainly hope that this does not deter anyone from choosing medicine as their field, but gives more understanding of the challenges and reward that this profession has to offer. Any last message to our younger generations out there, or those who aspire to be a doctor one day?
Well, student, as a doctor, I'm forever a student and forever a teacher. I learn from my experience, and my patients are my tutor. But always remember, don't compete with others. Compete with yourself. Make sure you are better today than yesterday, and you will be better tomorrow than today. Manage your stress. Best thing in life is not money, it's health. Take care of your health, your parents, siblings, and the loved one health. With good health, you can dream anything you want and pursue it. Respect your teachers, the elderly. Whatever you do it because of Allah. Bukan untuk mendapat pujian manusia. InsyaAllah anda akan berjaya.
I think we have covered a lot of grounds today, Dr. Noraza. And thank you for sharing your experience, all the goods and bads about being a doctor. And I hope you inspire a lot of students out there to become a doctor. Inshallah, some of them will be a consultant ophthalmologist in the future. So that's all we have time for today. And thank you very much for joining us in ESPKG Virtual Symposium. Thank you very much.
Thank you, Rosmawati, for inviting me. Thank you all.